Flu season now underway. There have already been 5 deaths in the Palmetto State alone from the illness. Doctors in South Carolina say the early flu deaths are not an indication of how severe this year's flu season is going to be, though. The spread of the virus usually peaks in February. Health officials say 4 deaths were from people in the upstate and low country regions. Shortly after those deaths, a CDC report came out saying that Georgia is #1 in flu cases nationwide this year. Despite that report, the number of influenza cases is relatively low for the Peach State. News Channel 6's Renetta Dubose joins us live with whether you need to be concerned right now.
While Georgia has high flu activity right now, people should keep in mind that it is not as bad as it has been in the past, and in order to keep it that way, prevention is key.
It's fairly early in the season. Our peak season is usually around December. If you look at last year's numbers, that's exactly when we peaked.
When coughing and sneezing turn into fever and severe aches and pain, you know it's the flu. The symptoms can sneak up on you just like the entire flu season has for the Peach State. University Hospital's Penny Shute can't tell us concretely why the flu happened so fast, but she suspects an older virus.
Several years ago, we had H1N1 come through. H1N1 was found because it is earlier or later than the normal flu season, and I wonder if some of that's still hanging around.
The Georgia Department of Public Health reports late last month there was minimal flu activity. There was a higher number of outpatient illnesses with no hospitalizations and no deaths relating to the flu. That same week last year, the flu was more sporadic across the state with a lower number of outpatient illnesses. There were no hospitalizations or deaths. In the Palmetto State, the flu hits harder. The second week of October shows the flu in various parts of the state, with visits for flu-like illnesses below the state baseline. The state health department reported 19 people in the hospital and 1 death that week. That same week last year, the flu was also sporadic with visits for flu-like illnesses below the state baseline. There were 11 people in the hospital and 1 flu death. Shute thinks the difference is in the way the 2 states report.
I do know that last year they had deaths before Georgia did too.
University Hospital has already had 2 patients get the flu, so patients, employees, and staff will all be required to get the flu shot. Those employees who don't get vaccinated by November 9th will have to wear a mask. So there is a big push for you to get the flu shot. Keep your hands clean and away from your face. Jenny?
All right, a lot of good advice there, Renetta.